A landmark event in the field of yoga and of health management is the founding of the Shivananda Institute of Health and Yoga in California, USA.
When vata is there, when you are lack of groundedness, what happens? You become anxious. You see?
The Institute's first 2-year Yoga Health Educator training course was launched at the Shivananda Ashram Yoga Farm at Grass Valley in California in October 2017.
But they have a real interest in learning the whole lifestyle.
It was followed by the launch of this intensive training course at the Shivananda Yoga Vedanta Center in Dalat in Vietnam in January 2018.
It's not an institution.
This yoga health education training course is a yoga therapy course, but we don't use the word yoga therapy because the idea that we're not talking only about disease and curing of disease, but we are talking about health and well-being. We are educating people to approach the person that has disease as a total person. That means their body, their mind, their emotions, the circumstances of their life. In order to regain health, we need to think of the 3 levels of health. Our spiritual health, when we recognize the truth about our nature. Our mental health, when we become very calm and be able to be concentrated. And our emotional health that comes with the mental health is when we have love in our heart. And our physical health is when our body functions properly under the intelligent control of the mind. So our soul quality is remembering who we are. That means remembering our essential nature that is good, that is pure, that is true, that is brilliant, that is knowledgeable, that is eternal, that has no fear, no worry, no anxiety, there is no comparison, no conflict with anybody, that is pure love. So this is our quality of life. Happiness is within, but we are looking for it outside. So the idea of yoga is to look for it at the right place by looking within. Instead of like a person that lost her needle and go outside looking for it because it's bright outside, there is light. And inside the house where she lost it is too dark. So we all the time running outward, looking for our happiness outside. So now we need to calm the illusion down and looking inward. So that's the process of yoga. Swami Shivananda was a medical doctor, and he's always concerned about health. He wrote about 30 books on health itself and about 200-300 books on different topics of yoga philosophy and yoga life. Because he was a medical doctor and he helped people to heal. But then he realized that people suffer from something else. Yeah, he can cure from the physical ailment, but because people suffer from something else, that's how he became a monk and he became the doctor of the soul. Swami Vishnudevanji, he came to this country in 1957 in USA, San Francisco, and he realized that people are not healthy. And that's how he has to start to teach health. And he combined the teaching in 5 points, called the 5 points yoga lifestyle for health and peace of mind. So proper exercise, proper breathing, proper relaxation, proper diet, means vegetarian diet, positive thinking and meditation. That we call the 5 points yoga life, that the health educator will be base their teaching on the 5 points, how to get back to your true nature of health.
I think modern medicine has some gaps. Modern medicine is largely focused on treating symptoms, treating outcomes, and not as well focused on prevention of those outcomes. And also not focused on the interface between the mind and the body. Modern medicine tends to be a bit divided between psychiatry on the one hand and physical medicine on the other hand. And the two really don't talk to each other, and yet obviously the mind and body are inextricably linked. And so yoga addresses that link between mind and body.
I played soccer for 28 years, and the last half of that time was a very high speed, very aggressive, very physical nature game that I played. And in 2013, me and two guys ran across the entire United States in 157 days, and we did this to help out sarcoma cancer families. When we ran across the United States, we visited over 120 hospitals and cancer research facilities. And I would go and sit with these doctors, some of the best sarcoma doctors on this planet. And I would sit with them one-on-one, and I'd ask the questions the families never got a chance to ask. All these doctors that I've talked to don't really have a holistic background, don't have a nutritional background, don't have a lifestyle enhancement background. Scientifically, they're brilliant, but when it comes to how to live and how to heal, without chemo, without radiation, without poisons, without toxins, 100% of the time, it just wasn't there. And it was heartbreaking to see that. It was very heartbreaking to see these families that are so desperate for a better way to heal, as opposed to these poisons that are being offered to them.
Swami Shivananda say that we are the author of our own health or disease. So what that means? That means that we have the power in our hands to heal ourselves. So we need to know and be more aware of our thoughts and mind, and have the basic knowledge of the connection between the body and mind.
The yoga health educator and the medical system can work together to provide real lasting health and wellness, and actually what we talk about is a positive state of health, not simply an absence of disease, but just knowing that what I'm eating, how I'm going about my day, my different working relationships, even the kind of work that we're doing in our lives, that it's a positive state in every aspect. When we talk about yoga practice, for instance, it's not simply for young, fit bodies, but it's for people of all ages, all physical capabilities. In fact, it's not really about limitation, as it were, but actually expanding in ourselves our own view of ourselves, that we are not actually limited.
Gentle yoga is a way of practicing the asanas, which are the postures that move the energy through the body, in a more gentle way so that it becomes accessible to people who may have an illness or lack of strength or lack of mobility or aging process, and they're just starting to want to move their bodies. When we are stressed, our immunity system goes down and our digestion goes down. And so gentle yoga gives people a chance to calm the mind and to move the energy through the body in such a way that it elicits the relaxation response, which then aids in their healing and also aids their mind to accept things as they are and then work with themselves in a better way. The gentle yoga class, again, like I said, it affords us the opportunity to learn about how our mind is working against us, how we are pushing ourselves. And it really takes courage and I think when people come to gentle yoga, they are looking for something different than just exercise. They intuitively know something is not working, and they're also yearning for some more information beyond just the physical body, especially if there's an illness and they're working with that. And also in aging. You start to, as you age, you start to notice there's people around you that are not there anymore. They're at loss. And so you start to question, what is life about? How do I deal with death, these bigger issues? How do I deal with my own aging? And so when they come to a gentle yoga class, they're given an opportunity to slow down and have time to reflect. And like I said, the teacher sets an atmosphere of love and compassion, and it's not about doing, it's about being. And exhale down. Good. And inhale out. And exhale down.
It's like going back to the source of who we are as pure vibration. So the more we connect with sound, pure sound, it feels like we are connecting with the true self. The ancient traditions, they all, and also immemorial times and traditions and worlds, been using sound to heal as a gateway to expand consciousness, going beyond the confinements of personality. Sound is the most intuitive form of psychology. It changes you immediately.
So in this course, we put together the yoga philosophy, yoga psychology in relation to health. We also teach the health educator into Ayurveda and the process of healing of Ayurveda, that is also the Vedic science, so it's based on that ancient wisdom.
I was very excited when I was approached by Swami Sita in working with the development of the Shivananda Yoga Health Education course. Ayurveda is often said to be a sister science of yoga. You could think of them as twins. They come from the same parent. Where yoga works with balance of the mind and helps one to achieve their spiritual goals, Ayurveda focuses more on balance of the body to help one have the strength, the stamina, the endurance to achieve their goals.
I was trained as a biomedical engineer. I have a doctorate in biomedical engineering. So my contribution to the yoga health educators training is the anatomy and physiology, some of the study of the pathology. We have other doctors that are discussing medical interventions, standard medical interventions. My purpose is to provide the students with enough background in anatomy and physiology that they have a real understanding of the traditional medicine terms and procedures.
I'm a family physician in Norwood, which is a small town in Ontario, about an hour and a half outside of Toronto. I tried physio, I tried chiropractors, I tried massage therapists, all of whom I knew, all of whom were good people, but they didn't fix my back. And somebody suggested that I try yoga, and it did fix it. So that was the proof for me personally. So here I am. It's about 15 years since I started yoga, and increasingly I'm being attracted personally to the Shivananda yoga. I'm seeing and meeting people that it's doing remarkable things for, and I'm not talking about just fixing the back of the body, but yes, that. And I now think as I study it more that the future of our whole world looks much better with Shivananda yoga. So I'm here to stay. I would recommend it for anybody who wants to try it. I know there's a physician program starting up. There's a lot of failure in Western medicine. I have so much obesity, so much diabetics, high cholesterol to deal with, mental health, depression, addiction stuff. And I send them to the services that are available. But increasingly I find, and I personally am convinced, we could save the healthcare system fortunes and make people feel better if we could introduce them to Shivananda Yoga.
But they don't have enough knowledge or information that help them to positively go.
The scientific medical discoveries and advancements can help, can join together with that wisdom teaching of ancient classical yoga and meditation systems.
Check their nostril. It's dominantly functioning.
We are here in Berlin at Charité University, and since many years we do research in yoga, in the application of yoga for patient care. So in fact, I think yoga is a very important part of modern medical care for a lot of patients. That is what our research data imply. We are here a general hospital with a lot of patients, and all the cost of the treatment is reimbursed by the insurance company. It is not a private hospital, it is a standard university hospital. We now have in the hospital 3 full-time yoga teachers as part of our therapist team. And I think this is very nice, so that we just regard yoga as a standard treatment, and it is included in the professional staff.
So what is disease made up of, and what is wellness made up of?
As I started to practice medicine, I realized that the healthcare model which we are so used to is so much deeply rooted in disease management only. So the wellness side or the healthy side of the person is completely pretty much ignored. So I was always looking for a system of medicine, system of health, which will address the healthy side of the person as well. And in the allopathic model, the Western medicine model, as we know, that we have sort of divided the human body, and we have specialized the care depending on different body parts. So there are so many specialties and super specialties. So it's time now to bring everything all together in one unity and empower the individual, because the healing powers really are well within the person. So science of yoga and Ayurveda, they're traditionally designed that way to keep a person totally healthy, and not only healthy, but mentally peaceful.
As a yoga teacher, this is the most important thing that you need to remember. The connection between body and prana, the connection with body and mind. Okay?
Shivananda Yoga Ashram produces a lot of yoga teachers, and they have done hundreds and thousands of them over the years. But I realized that these yoga teachers, they need to become more familiar with the traditional healthcare system as well, so they can be useful with their expertise, with their training for medical establishment, for medical doctors. So this particular course allows them to learn academically as well as practically, to be part of the healthcare system, to work with the doctors hand in hand in the care of the patient. So the patient gets to have the medical care he or she needs, but along with that, he learns the philosophy and the science and the wisdom of yoga and Ayurveda as well, to stay healthy and to promote more wellness in him.
Both my parents were physicians. My mother was a family practitioner. My dad was a general surgeon. My father actually was diagnosed with lymphoma when he was 54, and he passed away 5 months later. And I remember when he was first diagnosed, his immediate reaction was, "I don't want chemotherapy. I don't want any of it. I think I was 19 at the time, and I was upset and I cried and I said, please go and get treatment and everything. And so he did, and he went through the chemotherapy. And in the end, he was hospitalized. He was breathing artificially. He wasn't conscious. He didn't look like himself. We couldn't really communicate with him. That's the kind of death he had, and I think in his heart he knew that he didn't want that, and he knew that there must be some other way. And I noticed the same thing with my mother towards the end of her life. Though she took medications and she had surgeries and treatments, but I think she didn't want to die in a hospital. And I think it was much the same thing. She knew that wasn't the way. She knew it wasn't ultimately going to heal her, but she didn't know what else to do. So a few years ago, I think it was 4 years ago, I was planning to have an elective procedure that at the time I was convinced I needed to have. One night I dreamed that my father called me. And at this point, my father's been dead for many years. But in my dream, he called me and he said, Priya, no hospitals. There's nothing wrong with you, no hospitals. I think that being led to yoga and then being led to the health educator program for a reason, because I think there's something there that's missing that a lot of people are craving and not getting. So yeah, there's something here that people need.
I have this condition that's called the restless leg syndrome. It's also called Willis-Ekbom disease. It's a neuromuscular pain in the leg, and I've had it for about 15, 20 years. And since it's a neuromuscular condition, the medicines are neurological, invasive to the nervous system. Meditation and pranayama actually helps me keep the pain either in control or pretty much not experience it at all, which helps me also not take the medicines. That's one. The second is for diabetes. I used to take the highest dose of sulfonylureas about 6 months ago. Now I don't take them at all. Again, about 6 months ago, I was diagnosed with an early onset of retinopathy, which is because of a combination of high blood pressure and high sugar. And the last time I went for my test, about 2 months ago, the doctor kept looking, and she said, I can't find your retinopathy. She said, you've pretty much reversed it. So my doctor, who's been treating me for the last year or so, is so excited that she wants me to finish my training, come back and start teaching her yoga. She said she would be looking forward to it.
In this course, there's a particular emphasis on the health aspect. So promoting health on all levels: physical health, mental, emotional health, spiritual health. So we see that in many cases, the health systems that are in place, the medical systems that are in place, that are very much focused on dealing with people's symptoms, that are very much focused on uses of different uses of drugs and surgery. We see that there are many problems there, in many cases that it's not working. And we know that there's a whole body of knowledge of how to live, how to conduct our life, how to interact with the world, how to interact with each other. If we follow it, this can alone promote health, can avoid health problems.
I think there's great usefulness for Ayurveda in the modern world, especially alongside modern medicine, because we need to be able to recognize our own self. And Ayurveda gives us this strongly with its idea of constitution. The modern medicine tends to emphasize this one-size-fits-all, And certainly it's based on very efficient research and science, and yet we also have to be able to recognise what's true for us, and so that becomes more of a recognition of our own inherent nature. So we have an appreciation for the unique self that we are and how we can take measures to balance that. So the need of the view of the self is most important today, especially in a world of where our attention is taken by the media, by externals, distraction, increasingly so more and more. And so the training of the Ayurveda and yoga within the health education process is for us to take the attention within and become more aware, pay more attention to what's happening within us as we engage in the modern world. And then we can remain intact even with the demands of the modern life.
One of the things that I've been really drawn to about yoga is that it has a higher standard for health. Whereas modern medicine, modern psychology, the focus is on the absence of disease. But there's very little focus on flourishing, on happiness, on bliss, on enjoying life. And yoga, on the other hand, says that health is being happy, experiencing bliss, experiencing love, being in touch with yourself. So it's a higher standard for what we need to accomplish in order to really live our lives fully.
Yoga teachers say everything will be fine.
One of the powerful aspects of this training is Swami Sita in the energy that she brings to this course. It's clear that the knowledge just flows from her head. She's not really reading from anything. There's so much knowledge and organization and understanding in her mind that comes out so clearly. We also need to bring that same strength, that same energy in order to help to heal those that we are working with.
Yeah? So you have to be like a lawyer. You have to.
My name is Shani Robbins. I teach at several universities, including Stanford University and Foothill College, and Institute of Transpersonal Psychology. And I'm a psychologist, I'm a clinical counselor as well. Just a healthy body helps tremendously, and so if we can help that with the exercise part of yoga, that alone is wonderful. But then of course we can go way beyond that in terms of calming down the mind. And so the more calm we are, the more open we are to others. And so the empathy and compassion starts coming up around that. So as a psychologist, empathy, mindfulness, compassion, those are highly correlated skill sets with a lot of good things in life. Positive relationships, success in the workplace, getting along with others, health.
I've suffered from anxiety and depression all my life, starting in my adolescence, and I never really got the healing that I needed from the conventional psychiatric care. The healing that I got from the ashram was a really holistic and overwhelming sense of relief.
I've just seen the, chaos that's basically going on among teenagers, and especially the substance abuse that's going on in the high schools. They need help. They have no idea where to turn to. And they're all basically numbing their feelings. They're numbing their true nature because they have the feeling they are not able to be who they are. There's not enough compassion, or there's just they need help. They need help at the end of the day, and it's. I think yoga can give us that.
So when we use yoga now in the addiction field, we're actually trying deliberately to help people build new skills, to tolerate the impulse to use the old skill, So build a skill that they can come into and use, such as getting comfortable feeling uncomfortable about growing and evolving. That's actually a life skill. We overlook it all the time, but with addiction, it's preventing us from growing. So we need yoga to teach us how to get comfortable feeling and feeling uncomfortable even about joy and recovery and expansion and possibility. And the addiction ends up actually falling away as a resource that's now outdated and was once overused. And yoga becomes the stabilizing force in our lives.
I'm a psychologist. I have a PhD from Stanford in counseling and health psychology. Then I did both a pre-doctoral and a postdoctoral fellowship in preventive cardiology at the Stanford School of Medicine. Most people have no idea what actually causes health. Most people don't think about health until they get sick. And most people have very little understanding of the role of their mind and their emotions in anything. Like they're just basically doing their life with not that much thought and awareness. And when their physical being is impacted, they feel sick and sometimes they try to get help. So a health educator would be very important in reminding people of the multiple ways that people can be healthy, of the multiple channels with which they can work on themselves.
You calm down the breath. The breath doesn't come out anymore.
A training like this brings a spiritual element to it, but brings a tangible reminder that the yogi tradition has 3,000 years of practice in helping people be well.
First of all, health is our birthright. Health is not absence of disease. It's our natural state. Because once we've established that, disease is when we forgot that fact and we get out of balance, then the manifestation could be disease or other discomfort. Yoga can show us ways to reconnect and to reclaim our heritage and return back to ourselves, back to our natural state of health.
In the recent past, science and technology had been separated from spirituality. However, much scientific research done in the last 4 decades has confirmed the far-reaching benefits of yoga and Ayurveda. The world is today reaching out to integrate this ancient wisdom with the modern developments in medicine and psychology. The intensive 2-year Yoga Health Educator training course is an exciting initiative of the Shivananda Institute of Health and Yoga. Here, scores of students are working with doctors to learn to contribute to the mainstream healthcare system. They are learning to add the dimension of holistic health promotion through ancient wisdom, through the science of yoga and Ayurveda.